For decades, psychology has operated under a specific assumption. When a person experiences behavioral pathology, severe loneliness, or psychological distress, the source of that distress is located strictly inside them. The individual is the boundary of the problem. Even the biopsychosocial model, which broadens our perspective to include social factors, treats human identity as a relatively fixed internal trait. It treats the environment as an external variable that acts upon a self-contained mind. But we have known since Kurt Lewin established the foundational axiom of social psychology that human behavior does not exist in a vacuum. Behavior is a function of a person interacting with their environment. To accurately diagnose the distress of the modern world, we have to update Lewin's formula. We need to redefine that environment as a complex, overlapping ecological identity system. The Ecological Identity Model illustrates that identity is distributed across surrounding relationships, institutions, and cultures. This shifts the clinical question. Symptoms of distress act as indicators that these important relational networks have become misaligned. Psychological distress represents an evolutionary alarm bell. It signals a structural disruption in the ecological environment that normally sustains the self. To understand why a disrupted environment causes so much internal pain, we have to look at how identity is constructed. Personal identity is not authored internally and then projected outward. It is built from the bottom up, using external templates provided by the social world. Longitudinal data, like the recent work by Sujimura and colleagues, demonstrates this mechanism clearly. Group belonging and social identity precede personal identity. We locate ourselves within a group first, and that group structures our individual sense of self. We map the environment exerting this pressure into 3 distinct ecological layers radiating outward from the individual. The outermost distal layer contains the broad cultural narratives and historical forces of a society that set macro-level expectations. Moving inward, the intermediate layer consists of institutions, schools, and workplaces. Finally, the proximal layer is the immediate network of family and peers. Both of these layers exert direct normative pressure on the individual. Researchers like Hughes and Smith have shown that human behavior automatically tracks these environmental norms. We do this at an implicit level to maintain psychological equilibrium with our surroundings. You are constantly adjusting your internal sense of self to match the strongest normative signals coming from these overlapping layers, often without realizing a negotiation is taking place. The self is a precise receiver. It reflects explicit and implicit demands of the external networks that provide a sense of belonging. When the signals from these ecological layers agree on who you're supposed to be, you achieve an optimal state known as identity resonance. When family, institutions, and cultural narratives all reinforce the same trajectory, the individual experiences deep psychological flourishing. But modern life rarely operates perfectly. Often, family demands one set of values, while the workplace demands another. This generates identity cross-pressure. This dissonance takes a severe cognitive toll. Attempting to integrate conflicting identities forces the brain into effortful, analytical processing, what psychologists call System 2 cognition. The brain cannot sustain high-load System 2 processing indefinitely. Prolonged identity instability exhausts cognitive resources, disrupting the individual's ecological identity balance. Once exhausted, the brain engages a defense mechanism. It actively seeks immediate relief from the complexity of holding multiple, conflicting identity signals at once. Rigid binary narratives remove the ambiguity of competing signals. This allows the brain to shift from effortful integration to the fast, intuitive coherence of System 1 processing. When complexity becomes a source of pain, a singular, absolute identity provides structural relief. In this context, rigid conformity is less an intellectual choice than a survival mechanism for an overtaxed identity system. We can see these exact mechanics driving common clinical phenomena, particularly the experience widely known as imposter syndrome. Consider the role of symbolic mentors. These are distal cultural narratives or historical figures that act as identity templates, pulling an individual toward a new field. This happens when a woman is drawn into a STEM career by a fascination with problem solving, or when a Native American first-generation student navigates the university system to advocate for their community. The aspiration is clear, but the internal pole of the symbolic mentor collides with a lived institutional environment lacking identity safety cues. The environment signals the individual doesn't fit, and they internalize this structural collision as a personal failure. This is why telling someone to simply be more confident fails. Internal affirmations do nothing to address the missing structural safety cues in their surrounding environment. Imposter syndrome is rarely a deficit of personal confidence. It is a highly accurate psychological read of objective ecological dissonance. Beyond the individual struggle, these ecological dynamics govern the stability of entire social systems. This is the personality ecology principle. Individual personality differences are not deviations from an ideal. They are complementary functions that allow a network to survive. Extroversion rapidly spreads ideas across the network, while introversion refines those ideas and preserves cultural memory. A healthy ecology requires this exact distribution. It needs explorers to drive rapid system adaptation and tradition keepers to maintain structural continuity. The system becomes fragile when it devolves into trait monoculture. Modern individualistic systems, for instance, heavily value constant assertiveness and hyperproductivity. When an environment only rewards a narrow set of traits, it forces the rest of the population into widespread trait suppression just to secure basic social belonging and economic survival. Suppressing your natural trait profile to meet environmental demands generates chronic internal identity cross-pressure, leading directly to systemic burnout. A healthy psychological system does not attempt to minimize human difference. It structurally depends on that diversity to prevent ecological collapse. Historically, the field of abnormal psychology has repeatedly shifted its lens to manage and treat human distress. Each historical model, spiritual, moral, somatic, and cognitive, simply reflected the dominant worldview of its era. The ecological identity model integrates these past paradigms, treating each biological, cognitive, and social factor as a node within a larger relational network. This framework closely aligns with Indigenous epistemologies. Wellness is not defined by the mere absence of symptoms, but by active balance and reciprocity among the individual, their community, and the natural world. The traditional clinical approach isolates the patient from their context and attacks the symptom as an internal flaw. We need a new clinical mandate. For practitioners, educators, and institutions, healing must be defined as the active restoration of ecological balance and identity resonance. We cannot cure a societal epidemic of loneliness with individual therapy alone. We have to rebuild the physical and social architectures required to safely house complex human identities. To do that, we must stop asking, what is wrong with this person? Instead, we must look at their environment and ask, which relationships have ruptured, and how do we restore the system?